sometimes when you lose your tingles, the only thing you can do is use very intense triggers. Don't get distracted. Coconut, coconut, and very good. Just a little. Hi, welcome to the clinic. I see we have you in for a tingle examination today. Seems you have lost your ASMR response, huh? Yeah, well, that happens from time to time. Please take a seat, get comfortable. And we'll give you a little bit of an exam and see if we can't get those tingles back, shall we? So, when did you notice your loss of tingles for the first time? Okay. And how much ASMR have you been watching? Alright. Well, I don't think it could be an ASMR overload, so there must be a different explanation. So let's get these gloves on, and we'll get to testing those tingles, shall we? So, do you respond more to auditory tingles or visual tingles and triggers? Okay. We'll do both today, just to make sure that we cover all our bases. And do you have a preference in your video type, or do you watch a little bit of everything? A little bit of everything. Well, that's good. ASMR is such a broad and subjective experience that you never know what you'll find out there. So, let me just look at you real quick. I just want to make sure you don't have a, bump on your head that's causing this tingle loss, Just take a look, Look through your hair a little bit. And if at any point during this exam you do experience an ASMR response, please let me know, so we can try to replicate said response and get to the bottom of this issue. So first, I think we're going to start with those eyes of yours. Alright, how's that sound? Good. So we will do a simple follow my finger. Alright? So I want you to just take a look at my finger. Just take a look. Take a look. Take a look. And now, just follow. Just follow the tip of my finger. Good. And we'll bring it in and out, in and out. Keep following. Keep following. Don't get distracted. Don't get distracted. Don't get distracted. Keep following. Don't get distracted by my other hand. Don't get distracted. Very good. Very good. Alright, and now follow this finger for me. Same thing. Just follow the tip. Follow the tip. Follow the tip. Just watch my finger. You're doing very good. And don't get distracted. Don't get distracted. Don't get distracted. Good. Good. Okay. Did you experience any tingles? Any tingles whatsoever? Alright. Well, we will continue our test with your eyes. So first, we're going to use this light. It's fairly bright. And I just want you to follow, okay? So first we're going to start with a little in and out. And just follow the light. Follow. There we go. Please let me know if at any point in time your eyes begin to feel heavy. If you hear any rhythmic snoring in the background, that is just our clinic therapy dog. He's a very good boy, but a very sleepy boy. And just follow. Follow. There we go. And just keep looking. There you go. Very good. Very good. There we go. Good job. Alright, blink a few times for me. Any response there? Alright. We're going to try a different light and we're going to do the same kind of thing, except this time I'm going to also test your pupil response just to see. Sometimes that triggers a response in my patients. So we'll start off with that, which means I'm just going to put my hand here and I'm just going to swing the light in and then out, looking at your pupil. Make sure it dilates, make sure there's no physical problem preventing you from getting those sleepy tingles. Very good. You're doing great. There you go. Very good. And let's do the other side. There we go. Good job. You're doing spectacular. And if you do fall asleep during this exam, that is a-okay. We have a sleep clinic right next door. Very good. Wonderful. Go ahead. Blink a few times for me. Great. Alright. Still using the same light. We're going to do another follow the light. So this time I'm going to get really, really close. So just follow it. There you go. I know this can be a little intense, but sometimes when you lose your tingles, the only thing you can do is use very intense triggers. If this hurts your eyes at all, let me know. Just keep looking. Just follow that light. Very good. Keep following. There you go. Very good. Just keep following that light. Alright. Let me know if this makes you dizzy. Shouldn't. Alright, we can get really close again. Alright, here we go. Good. Good. Very good. You're doing absolutely fantastic. Very good job. Wonderful. Any tingles? Anything at all? Okay, well, let me take another look at your eyes. I'm just going to put my thumbs right under and just run them under your eyes. Let me know if there's any pain, you feel any weird pressure. Alright? Yeah. Just gonna run the eyelids there. Yep, that's the therapy dog. Seems to be having a little bit of a dream. He really loves helping people. Alright. Alright, let me do one more thing with your eyes here, okay? So what I want you to do is I want you to close them real tight. I'm going to try to open them, but don't let me open them, okay? Alright, ready? Go ahead, and don't let me open, don't let me open, don't let me open. Very good. Alright, take a breather for a sec. Alright, one more time. Don't let me open, don't let me open, don't let me open. Wonderful. Alright, so we're going to move on again, and we're going to do a little more eye tests. Now we're going to do 2 fingers. And again, we're going to test your peripheral vision this time. So what I want you to do is watch my fingers, and they leave, and I want you to let me know when you can't see them. And when they come in, let me know when you can see them. Alright, so here we go. And Good. Great. Let's go this way. Good. Great. Good. Fantastic. So, any tingles with your eyes? No. Alright, so why don't we move on to your ears next to see if we can trigger a tingle response from an auditory trigger. How about that? Alright. So first things first, I'm going to go over here and I'm just going to blow gently in your ear and let me know if that causes any kind of tingling. Anything? No. Alright, one more time. Anything? Alright, let's try the other side. Anything? Alright. Anything? No? Okay. I am going to try to use a tuning fork to initiate an ASMR response from you. Now, these are quite popular. The vibrating tones seem to send those nice little shivers right down your spine. So why don't we try that? Go ahead and close your eyes for me. Just close them. Alright, here we go. Anything? Maybe a little? Alright, let's try again. Okay, we'll keep going. We'll just try different patterns to see if we can elicit that response. Alright. Do a little shaky wave. Anything so far? No, okay. Do this a couple more times. Last one over here. And one more over here. Anything. Alright. Well, why don't we try some trigger words then? Alright, so keep those eyes closed for me. And I'm just going to whisper a trigger word in your ear. Coconut. 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 No? Okay. Relax. 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 No? Alright. Pineapple. 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 Chocolate. Pineapple. Chocolate. Pineapple. Chocolate. Coconut. Pineapple. Chocolate. Coconut. Pineapple. Chocolate. Coconut. Pineapple. Chocolate. Coconut. Anything at all? Alright. Let's try some direct ear stimulation then, shall we? Let me know if this elicits anything. Okay. Am I right there? Okay, let's try this. You might have a very serious case here. We may have to refer you to a specialist. Well, we'll get to the bottom of this for you, I promise. So one thing that I know elicits a very, very good response from the majority of my patients is the touch test. Do you know what that is? No? Okay, so what I'm going to do is ask you to close your eyes, and I'm going to touch you with either a soft object or a sharp object. Alright? And I need you to tell me what you feel, whether it's soft or sharp. Alright? And I have a multitude of objects we are going to utilize today because we really need to get to the bottom of this immunity that you seem to have developed. Alright? So we're going to start off easy. We're going to use this very, very tiny, very fluffy little brush, okay? And all I'm going to do is just brush it very gently against your skin. Feel. See? Not a problem. And then I'm going to use this tool, which is very dull. Won't even pierce the glove here. And this is kind of, we'll call this the sharp one. And I'm just going to gently touch you with it, alright? So why don't you close your eyes for me, my friend? Alright. Here we go. And poke. That was the sharp one. Very good. And poke. Soft. Very good. Poke. Soft again. Poke. That's the sharp. Very good. Poke. Soft. Poke. Sharp. Very good. Poke. Soft. Okay. Poke. Sharp. Poke. Soft. Poke. Soft. Poke. Sharp. Alright. Very good. Well, now we are going to keep testing you. For this next one, I'm going to use this dull tip as our sharp object. And then I'm going to use this little tool here. It's a very flexible. And this is actually designed to test your senses. So, I'm going to ask you to close your eyes again. And this time, let me know if you can feel that brush just like that, okay? Alright, so here we go. And poke. Good. Good. Alright, you've noticed the new sensation. Good. Good. Poke. Good. Poke. Very good. Good. Poke. Wonderful. Good. Alright, very good. 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 Now I'm just going to go down to your arms here. How does that feel? Good. The other side. Very good. Alright. Put these away. Now we're going to go a little more extreme, or I should say intense with these next two. So on the soft side of things, we have this feather. Okay, very soft. Feel. See, not a problem. And then we have our pinwheel here. Now this is fairly sharp, so I'm going to be extremely gentle with you on this, but I will not hurt you, I promise. But being that this is a very intense case, sometimes we must take intense measures, alright? So close those eyes again. Don't worry about a thing. You're going to be just fine. Alright, so here we go. And very good. Just a little. Good. Yeah, see, it's sharp, but not too painful. Good. And you'd be surprised. Some people enjoy the pinwheel. Okay. Good. Good. And just, all right. Very good. Okay. All right, you can go ahead and open your eyes. So, how do you feel now? Any more relaxed? No? Well, relaxed a little bit at least? Okay. How about any kind of tingle response? Alright. Well, it seems you might have become immune to medical triggers, which, you know, that happens from time to time. You watch enough cranial nerve exam videos and that will happen. So what we're going to do is we are going to move into some non-medical triggers, if you will. Just some tests to see if there's anything that's going to trigger that response, alright? Alright. So we're going to go over here and we're going to pick out a few things. We're definitely going to want the large, very fluffy brush. That's a must, a favorite. We're also going to try some water triggers with you today. Those are popular among a few. And then we will do some acupressure and some Gua Sha on you, okay? Alright. So, actually, why don't we start with the water triggers? So these are actually freezable massage orbs, filled with water, obviously. But they make a most delightful bubbling sound. At any point, please let me know if this triggers any kind of tingling, any kind at all. Anything so far? No? Alright. Well, we'll give it a little bit longer. Anything? No? Alright. Well, it was worth a shot, right? why don't we try one of my personal favorites? A little face brushing. So we'll just brush, brush, brush. We'll let all that stress, worry, and tension go away. Here we go. Very good. Just relax for me. Keep your eyes closed. Keep your eyes closed. There you go. There we go. Very good. Just a little bit more. A little bit. A little bit. A little bit. Okay. There you go. Very good. Feeling more relaxed. Good. This trigger is one of my favorites. Always works for me. Brush, 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 brush. All right. A little more relaxed. Why don't we do a little Gua Sha treatment to try to just ease that stress away, okay? Alright, relax, my friend, relax. We'll make sure you get your tingles back, I promise. There we go. This is going to pull away the stress. There we go. Get that other side. Very good. You're doing wonderful. Very good. Very good. And why don't we finish off with a little bit of acupressure for your ears. Relieve those tension points. Sounds good? Good. And you should be feeling very relaxed. We've run quite a few triggers on you today. Alright, here we go. Just gonna press it into the ear. Wiggle around. Release that pressure point. Good. And wiggle around. Good. Good. And we'll come over here. Just gonna work that out. Here we go. You've been a wonderful patient today. All right. So that should relieve a lot of stress for you. How are you feeling? More relaxed, I hope. And I hope that the next time you watch ASMR, you feel those tingles again. So, why don't you go home, drink plenty of water, rest, relax, pull up your go-to ASMR video, and try to get a good night's sleep, okay? Alright. I'll see you soon. Bye-bye.